Hi, good afternoon, everybody. Happy Friday. Welcome to this afternoon's webinar. This is Staci Jones, DDA's Employment Services Coordinator. Before we get started with the presentation, I want to just talk about the webinar platform for a minute for those of you that are new. All participants are in listen-only mode. And as always, there are two options for listening to the webinar, either through your computer or your phone. So if you have trouble hearing at some point through the presentation, you may want to try switching. If you look on the right-hand side of your screen in the panel, you will see a handouts button. And please note that the slides that I'm going to be sharing with you today are available for download right now. So you're able to take those, print them off, view them electronically if you'd like. Today's webinar is being recorded, and as always, we will upload it to our YouTube channel, as well as on the DDA website in the next week or so. And along with that, we'll also include the slides along with the PowerPoint. So throughout today's webinar, if you have questions, you can type them into the questions box, and at various points throughout the presentation, I will stop for a minute and see if we have questions, but I'm going to monitor them just at various points in the webinar. So let me tell you a little bit about what we're going to talk about. Really, the entire webinar is focused on meaningful day service transformation. So if that's what you came for, that's what you're going to get. It's going to be very limited in focus. So it's just going to be a few focus areas, not on everything related to meaningful day services. So if there are questions or things that you want to know about outside the scope of these items, I'm not going to be addressing them today, but please know that you certainly can ask questions and we can look to get you the answers. I'm going to be providing an overview first and foremost of DDA's Employment First transformation and where we are in that process right now. I'll be showing you where to find our meaningful day policies on our DDA website, and I'm going to be highlighting just a few examples of the policies and things that I want to make sure that people are paying attention to. I'm going to talk about the concept of value-based payment models as they refer to waiver services. I'm going to be providing some additional guidance related to our pre-vocational service or career exploration, in particular defining service reauthorization. We'll talk a little bit about tiered standards, what they are and what we are discussing and related to tiered standards. And I'll provide a brief update related to the home and community-based settings rule. And then finally, some basic wrap up and next steps. So that just gives you an overview of what I'll be talking about. So as we get started this morning, or this afternoon, pardon me, I want to acknowledge that a lot has happened in the last year or so since we've provided sort of an overview of transformation. So I want to really do a quick recap, and some of these things might be review for some of you, but I also want everybody to get grounded on where we are in that process of transformation. So as a generic reminder, employment is one of DDA's 5 focus areas. I don't think that's news to anybody. And to that end, years ago, DDA set out to align its system to really embody the principles of employment first. And at the core of that is the principle that all people who want to work can work and contribute to their community when they have the right opportunities and the right training and supports that build upon their own unique talents. And this webinar is not in any way going to go into details about any of those principles. However, if you want to hear more about that and what it means, there is a link to the DDA Employment First dedicated page where you can review lots of resources related to that. So DDA systems alignment has included multiple actions and a lot of different layers of things. Some of these alignment strategies that I'm going to talk about, or actually I'm not really going to talk about them, I'm just going to tell you what they are, but there are some links if you have never heard of them before, you'd like to learn more about them, because really this is just a quick recap. So DDA has collaborated with state partners related to employment outcomes. We've collaborated with families and other stakeholders as we've developed our the vision for what our system looks like. We have facilitated activities that focus on building capacity among DDA-funded service providers and DDA staff to better support increased employment outcomes for people in services. We have helped support the phase out of 14C certificate usage and the end of sub-minimum wage, which officially did end in Maryland in September of this year. And we were very excited to celebrate that milestone. DDA has engaged in a rate setting study, which I think most of you know about, to better ensure that any new or existing services are provided at the appropriate rate. And we have engaged since 2014 in the Maryland Employment Data Initiative, which gives us long-term data around how many people are working and what types of jobs people have and their wages. DDA has provided technical assistance opportunities to providers who are engaging in organizational transformation. Some of that has been through webinars like this or trainings that we've provided throughout the state. Other opportunities have been directly between a subject matter expert and providers. We've provided resources like the ones that we put on our website. We have a monthly newsletter, and we've supported providers related to the CMS final rule compliance, which comes into full effect in 2023. And I'll talk more about that towards the end of today's webinar. And finally, the one that I want to talk more about is that DDA has been realigning our meaningful day service system. And at the heart of that realignment is that our services, our systems, and our values are realigning to support competitive integrated employment and community participation. So we wanted to create a system that was flexible so people could choose from multiple service types and based on individually identified outcomes and what they wanted for their lives. Services are going to be going from a daily rate to fee-for-service model, which I think, again, is not news to anybody. We've been talking about this for multiple years. And services were designed and based on best practices in employment and community life engagement so that we could, again, so that we were focused on getting those high quality outcomes for people. So again, this webinar is not going to be a deep dive into particular services. So if you want to have a refresher or go back and listen to previous webinars we've done where we've gone through each of the meaningful day services and defined them and talked about the scope and those sort of things, you can click on one of these links. It'll take you to our YouTube page where those are recorded. And you can also go to our archived webinar page. So a big part of the meaningful day service alignment, in my mind, is really the unbundling of certain activities and aligning them to the proper services per guidance from CMS. And I also create in the left-hand lower corner, there's a link to the CMS technical guide, which helps guide a little bit of that realignment. And what I mean by that unbundling is we really took activities that CMS calls or labels as pre-vocational in nature and moved them from non-work services like day habilitation or community development services, and as well as from employment services, and we created a new category of service, a pre-vocational service called career exploration. And we did that back in July of 2018. So that service has been available since July of that year. And I'll talk a little bit more in depth about career exploration in a little bit. And the other part of that unbundling or that realignment included making sure that activities that are designed to support competitive integrated employment are then created or put into their own discrete employment services. So right now we have a service called supported employment, which is sort of a bucket, and inside that bucket of supported employment are these discrete services. And those discrete services are set to coincide with the long-term services and support system or LTSS implementation, which I'll talk about in just a second. So this is just a visual of what I just said, a visual of the unbundling. And again, none of these things are new. These are things that we've talked about before, but I thought it was worth revisiting since it's been a while. So on the left-hand side, you see our legacy system with our services that are based on daily rates. And then on the right-hand side of the screen, you can see our fully unbundled menu of services. So again, you can see that supported employment and employment discovery and customization are unbundled into those discrete employment services. So all of that was to get us caught up to today. And I kind of breezed through that, but this slide gives an update on where we are in all of that process. So back in December of 2019, so a little more than a year ago, a pilot group of people and providers began utilizing the unbundled services and the billing functionality that's available via LTSS. In July of this year, DDA began operating out of two systems, both the LTSS Maryland system and the legacy PCIS 2 system. So this means now and until further notice, person-centered plans will be completed and approved in LTSS Maryland. However, meaningful day services will continue to be authorized and billed through PCIS 2, with the exception of the pilot providers. So if you have questions specifically related to the use of LTSS, we aren't going to get into that here, but we have made a large number of resources available on the LTSS Maryland DDA provider portal, and there's a link to that on the slide. And related to meaningful day services, to help stakeholders better navigate between the two systems, DDA created resources like the Meaningful Day Service Mapping Guide, which was developed to walk through the different service names, the units, the scope, and the billing instructions for those two systems. So again, if you have not reviewed that, please take the time to do that at some point, because I think that it's a very useful document. And of course, I would be remiss if I didn't reference that overlaying on top of all of that, of course, we have everything related to the impact of COVID and the impact that has had on our system. And we have service flexibilities that have been made available during the COVID public health emergency via the use of the Appendix K. And again, I've linked to both the Appendix K and to resources that outline what those temporary flexibilities are. So if any of that is new to you, or you just need a reminder about where to get the details related to that, you can go to those resources. And as a quick review, some of the highlights of meaningful day flexibilities include the suspension of the required 4-hour minimum of support previously required to bill for services is now a 1-hour minimum within a given day. And there's also allowances and flexibilities related to the use of remote supports and telehealth, flexibilities on the types of settings and locations that services can be provided in, flexibilities on staffing ratios, and staff training and onboarding. So before I move on from there, I just want to take a quick look to see if there's any questions. If you'll just bear with me 1 second, and then I will move on. Okay, looks like we're good. And again, there are so many, really so many different topics I could delve deeper into, so I don't want to make it seem like I'm glazing over a huge reality, which we could spend the whole time on. The Deputy Secretary in his weekly or bi-weekly webinars has talked extensively about the concept of making sure that health and safety is the #1 priority, and really utilizing these flexibilities available via the Appendix K, and to continue to explore and look at what reopening day services looks like in a safe manner, and that the Deputy Secretary is in no hurry to rush any of those things. So this conversation isn't meant to rush that. I just want to make sure that I'm making you aware of other resources as well. So next I want to show you, first I'm going to show you something. And then I'm going to talk a little bit about a few DDA Meaningful Day policy highlights that I want you to be aware of. So first and foremost, I just wanted to give you a visual of DDA's web page. So this is our main website. And if you see that big red arrow at the top, that's just an arrow that I inserted in the slide so you could see this. You will see at the top it says policy stat. And I want to make sure everybody sees that and is aware of it, and that you go there and you actually look at the policies and read them, because there are a number of policies that have been uploaded and are now available. And I can't go through every single policy and I can't go through every single line, but I did want to highlight just a few that I want to make sure people are looking at and reviewing, so you have time to do the work on your end that you might need to do, perhaps as a provider agency of employment services. But please know that these few bullet items do not encapsulate all of the policies. So I would want you to go and read them in their entirety. Okay. So again, what I'm going to share here is not new information. It's just been put into an official policy. But I want to remind employment service providers that in addition to the DDA core training requirements, each employment specialist that will be providing billable services or deliverables under the discrete employment services of discovery, job development, and self-employment development supports must, as part of the requirements, show proof of competency by completing and passing the Certified Employment Support Professional, or the CESP exam, through the Association of People Supporting Employment First, or APSE. Hopefully everybody's heard of APSE before. And we want staff to be able to do that within 365 days of beginning their role as an employment specialist. So it may be that a provider agency that provides employment services may hire on someone, or perhaps somebody that's working in a job coaching role. We want that person to have time to be able to prepare for and take the CESP exam. So again, I would highly recommend that everybody that provides these services actually go to Policy Stat and review the policy itself. So again, we're still on employment services training policy. A couple of things that I want to point out: that this training policy will fully come into effect when full LTSS billing implementation happens, and there's no target date yet for that. So I want to just be clear about that part. However, there are still, in my mind, there are things that providers should be doing now, or to be thinking about now, to make sure that there are things in place as we approach that. So please note again that until final LTSS implementation is in effect, DDA will continue to pay for ACRE training and the CESP test reimbursement. And that's something that DDA has been doing for multiple years now. I linked on this slide to the memo that is uploaded to our website that outlines all of the details about that, including how to seek reimbursement. Please note that those reimbursement requests go directly to your regional office director. And again, all of that information is in the memo if you haven't seen it. And DDA will continue to provide additional information or additional time frames if these things change, okay? And next, I wanted to note that the policy includes a requirement that employment providers create and submit an employment services training phase-in plan, which will show how your organization is going to phase in the new policy, the new training policies, and the competency requirements. So again, as a note, DDA will be providing additional information about what I just said. So I don't want everybody to be concerned or worried. I just want you to be aware that that's part of the policy. But I think it's important for employment providers, again, to be reviewing the policy requirements and taking any action steps to figure out what that phase-in plan might look like for your particular provider. So this is just more of a highlight. So you don't, I guess my point is, you don't have to start generating these policies and submitting them for approval at this point. because we will provide more guidance. Okay, the next policy that I want to highlight is the Employment Services and Conflict of Interest policy. And again, these slides and these bullets don't include the policy in its entirety. I just took a few bullets that I thought were highlights, okay? So I know I'm a broken record, but the bottom line is I want people to go back and read these. But in summary, meaningful day service providers must establish, maintain, and publish their their conflict of interest policy to address possible conflicts as noted in this policy. And that means we want providers to provide full disclosure to people they're supporting regarding their choice of service providers, and that their competitive and integrated employment is not contingent upon them receiving services from any particular service provider. And really what that means in layman's terms, or in my own words, is that this speaks to what we've been talking about for multiple years about separating a person's employment from the support service that they may need to support their employment. So it helps to create a clear firewall between those two activities, and it helps providers to separate those two activities. So to continue, providers should outline policies that separate support services provided by the employment support provider and the ones that exist through a potential employer-employee relationship that doesn't fall under a billable service. So really what that speaks to is a scenario that sometimes exists that may apply to some people receiving meaningful day services, where a provider may be actively employing the person in competitive employment, so the person actually works for the agency, as well as providing a service to that person. Again, we want to ensure that those are separate and distinct, and that it's clear under which category the person is receiving supports related to their employment versus related to their services. And finally, the policy should ensure that Medicaid funds paid to the provider for the provision of those waiver-funded services are not used to pay wages to the person as an employee of the provider business, and are not used to defray the expenses associated with starting up or operating a business that the participant is receiving services from. So again, it's just another way of saying, again, separating those two things. And just like I mentioned in the training policy, DDA will be providing additional information to providers related to when this policy should be submitted and to whom it should be submitted for review and approval. So stay tuned in early 2021 for that. Again, my goal today is to bring to the surface the fact that these policies exist, to get providers to take a look at them and start having conversations about how those things are going to look in your organization. So I'm going to stop again really quickly and see if I have any questions. So bear with me. I have a question, and it says, my previous understanding was that CESP certification will be required for all employment services, but can you confirm? You just said it's only required for the 3 listed. That is correct, and that's always been the case. That is not a change. So the only services that require that level of competency are discovery, job development, and self-employment development supports. So things like job coaching that might follow under or might fall under ongoing or follow-along supports do not require that. And again, that's been outlined in previous webinars, as well as the memo that that went out a few years ago that I talked about a few slides ago. So, and the reason for that is that there is a certain skill level that's required for those 3 services that may not be required for someone that's doing a different task like job coaching. Good question. Thank you. Okay, so along those same lines of talking about employment services, I want to talk for just a minute about value-based payments. Again, this is going to be an introduction It's not going to be a full dive in here, okay? So I want to start by defining what value-based payments or value-based purchasing is, because it's something that we're going to be talking a lot more about at DDA. So it's just kind of introducing the subject and telling you where we are with it. So it's defined as any activity a state Medicaid program undertakes to hold a provider or a managed care organization accountable for the costs and the quality of care they provide or pay for. And I actually inserted a link here to ANCOR website, which is the American Network of Community Options and Resources. And they have actually a very robust section on their website just dedicated to value-based purchasing, including some data and some reports. So I would suggest, if you're interested, you can take a look at that. Also defined as a strategy that changes the way Medicaid providers are paid, moving away from fee-for-service payments, which tend to reward a volume of services being provided, instead shifting to methods that of payment that incentivize a particular value. And value could be a particular outcome, like a person getting a job. And then I just want to note here that the Centers for Medicare and Medicaid, or CMS, are urging states to explore and adopt these value-based models. So the reason I'm giving that background is because in DDA's most recent waiver amendment number 3, some of you may have noted that there were some proposed changes that were included in that amendment related to employment services, and more specifically related to job development and ongoing follow-along supports that were more in line with this value-based purchasing model, including the idea of incentivizing a particular outcome. And in this case, the desired outcome is competitive integrated employment. However, I want to note today that at this time, based on the public comments that we received, DDA will not be moving forward with those proposed changes. So just to be clear, no changes will be made to the employment services in this amendment. And so that means DDA will continue with our alignment as we've been talking about for multiple years, which includes the hourly job development and keeping the ongoing job supports and the follow-along supports separate. So the reason I'm saying this is so I wanted people to not be confused, because some of the feedback we got is that people didn't understand what was being proposed in the amendment. So we wanted to slow things down a little bit and take time to have a more in-depth discussion that will include a wide number of stakeholders. So, so while we're not making any of those changes in this amendment, like I said, we'd like to continue to have the conversation about how to develop value-based payment models in the future to better support employment outcomes. So to do that, one of the first things that we'll be doing is creating a value-based payment model work group. If you're interested in being part of that work group, you can email Patricia Sestoki and let her know, and we'll be kind of gathering all the names up and creating a list, and then we'll be getting the group together in the near future. And for those of you that are not interested in being on the work group, which is fine too, we will make sure that we keep stakeholders up to date on how those conversations look and where they go. So I'm going to stop here one more time and just take a look to see if we have questions before I get ahead of myself here. We have a question of what's the basic difference between ongoing job supports and follow-along supports. Again, I'm going to recommend, if you haven't already, to view our past webinars where I walk through in depth each of the employment services. But the really, really quick answer to that question is that follow-along supports are paid on a monthly basis to providers of people that are currently employed, as opposed to ongoing job supports, which are designed to be paid hourly for support that's needed above and beyond that monthly follow-along supports. And both of those services can be authorized and received for the same person. Okay? So again, I'm sorry to rush through that, but we have quite a bit of resources that outline those services, and I want to make sure that you have access to those. Okay. So a few slides back, I talked a little bit about the pre-vocational service called career exploration. And I want to take a minute to clarify a few things related to this that have come up quite a bit recently. So the things that I'm going to outline now, there are no changes. This is not new information. I'm simply clarifying. So to start, as a reminder about what career exploration is, there are 3 types of career exploration service. There is facility-based, which is a licensed service, and then we have small group and large group, which are both certified services. These are time-limited services that are designed to help a person learn new skills to work toward competitive integrated employment, which again is the goal of our service model, is that we want people to reach that goal if they're of working age. And here is what I want to drill down on, because there have been a lot of questions and confusion about this. There are 2 types of users of these services. There are what we would call legacy users and new users. And I'm going to walk through both types, and so you'll see it clearly on the screen. But again, I want to preface that this is not new information. It's just my hope that this will help provide clarity where it seems like there's been some confusion. So first, let me talk through who a legacy user of this service would be. And I took this information out of our draft service authorization manual. So again, this is not a change. This is somebody that would be authorized, that we would consider a legacy user, is somebody that the person, first of all, is 18 years of age or older and no longer in high school, and prior to July of 2018 had been working under a supported employment contract or had been working in a situation that was not considered competitive employment, but had been receiving those services through dehabilitation or supported employment. Because again, in 2018, career exploration was a brand new service. And also, in order to be authorized for this service, people must have a goal that outlines their transition to competitive integrated employment and some documentation that the person has made an informed choice based on knowing all of their options. Okay, and here's the critical part here, that in order to be that legacy user, all of those things have to be true. So the person was already engaged in some sort of pre-vocational activity prior to the service, and the person has been aligned to career exploration as of July of this year. And again, the service became available in July of 2018, and at that time, we began providing guidance that people should align to that service if they were doing those type of activities. Again, those paid work activities that do not fall under the definition of competitive employment and are more things that fall under the definition of pre-vocational. Okay, so that's the legacy user. Let me talk about a new user. So again, this would be somebody that's new to pre-vocational activities after the time that that the service came online, July of 2018. Or anybody that's newly authorized for career exploration for the first time after July 1st of 2020. And the difference for these new users is that new users can be authorized for career exploration only up to that 720 hours, which is the time limitation. And I'm going to dig down a little bit deeper here. So let's talk about what the renewal of this service looks like for both types of users. So we talked about what we need for a person to be authorized. Now, how could a person be reauthorized? So for a legacy user, the service can be reauthorized annually if the person maintains a current employment goal in their person-centered plan, meaning they still have a goal of competitive employment. And the person-centered plan or service documentation provides evidence that the person and the team is still working on that trajectory toward competitive integrated employment. In other words, it's still an appropriate service because the person's still interested in employment and is still actively working on that, whatever it looks like for that person. That could be very different from person to person. And that is in contrast to a new user and what renewal may look like for them. A new user may only be reauthorized if approved by DDA due to extenuating circumstances, including the new user gets through the end of their plan year and there's unused hours in their plan because they had a health issue. The person experienced something and they were unable to utilize those hours throughout the year. Or at the end of the plan year, there were unused hours because perhaps the person changed providers at some point during the year and the new provider, and there's hours left over and the new provider hasn't had the opportunity to provide those because they just switched. And maybe the person, again, same as the other, the person needs to maintain that employment goal in their person-centered plan and some documentation or evidence that the person is still interested in working toward competitive integrated employment. And why those two bottom pieces, again, are so critical, because if you go back to the slide where I talked about CMS guidance, the guidance is that's what the service is designed to do. It's not meant to be a forever service. It's not meant to provide employment for people. Instead, it's supposed to be time limited in nature and get the person to the bigger goal. So let me stop right here, check for questions. Thank you for your patience while I do that. Oh, I saw a shout out for APSI. All right, nice. Okay. And the career exploration conversation, I think, is a good segue to talk about tiered standards. Again, it's been a while since we've talked about this, so I want to start by reminding people what tiered standards means. First of all, CMS allows states to identify what they call a tiered standard in their waivers, so that only meeting particular standards established by the state will be developed in the future. So it's really a way, and again, in layman's terms, it provides a mechanism for states to kind of visualize where they want to see their service delivery system in multiple years from now and clearly state what that would look like. And it allows the ability to better align your services with those values and to kind of block out what next steps might be to get to that vision. So we've had, I guess, and career exploration is kind of a good example of that, and I'll walk you through that in just a second. But first, let me just, again, for those of you that may not be aware, back in 2016, DDA established a tiered standards work group. And that group has been made up of, I want to say, give or take about 20 DDA service providers. I might be off by one or two. The Department of Disability, Medicaid, Maryland Works, Max, CCS companies, people on the go. I'm sure I'm missing a few, but it's got a pretty good balance of participants in that group. And the facilitation for that group has been provided through the years from staff from NASDs. And it's been about a year, maybe almost just about a year since the group last met back in 2019. But a few things that group kind of landed on after quite a bit of discussion around, where do we want to see our service in relation specifically to things that used to fall under maybe employment or day-hab that don't really fit with competitive integrated employment. Where did we want to see those things go? So two of the things that the tiered standards group talked about, the first one was making sure that transitioning youth and all new people in services are offered discovery as a service option. And this was really discussed as a way to ensure that all people have opportunities to explore employment in a very individualized way that wasn't based on, you know, what kind of supports they needed or things like that. But and to that end, it is available to everyone, and you know, it would be available to TUIs and to new people in services. But I think that group talked more about how to have conversations with transitioning youth and new people in services to ensure that they understand that a pre-vocational service isn't the only option, first of all, and that it may not be the most individualized option necessarily to help people reach their employment goals. And the second thing that the tiered standards group talked about was, again, that time limitation for new users in that pre-vocational service called career exploration that we already talked about, with a limit of 720 hours, and which equates 90 days. So if you're wondering where 720 hours came from, it came from looking at 90 days of that pre-vocational service. So in 2019, what we discussed as kind of next steps, or what we wanted to pay attention to, we wanted to continue the conversation about career exploration, but we also wanted to continue to collect data, because again, at that time, we didn't really know how many people ultimately would be accessing that service. So all we could do was kind of make some predictions and see how they turned out. So we wanted to pay special attention to facility-based services, and large group career exploration. And some of the generic overarching predictions that we had back in 2019, first of all, we thought perhaps less people would seek facility-based career exploration because the sub-minimum wage 14C certificates were phasing out. So we thought there probably won't be as many people that are seeking that. And we also thought probably there'll be less people seeking large group because of the potential challenges with kind of community integration, with the community settings rule, and that we thought out of the three options, probably more people would access what we called career exploration small group, because that sort of fit more with what we were seeing, but we didn't have any data to back that up yet. So here I want to share what data we have as of September of this year. So we have, again, as of September, the number of people that are authorized for each of these types of career exploration. So for facility-based, we have 123 people authorized out of from among 14 different providers. For small group career exploration, we have 300 people authorized across 20 providers. And large group career exploration, we have 11 people authorized across 6 providers. So another thing to note here is that there are a few people that are in multiple categories. So we also looked at what's the number of unique people and unique providers. So in total, there were 417 unique people authorized for these services and 36 unique providers. So again, keeping in mind that, and I don't have the exact number in front of me, but we typically have around 12,000 people authorized for meaningful day services. To have 417 authorized in total for all of these career exploration services matches our prediction that less people would access that service and more people would look at the other services. So just some next steps there. DDA is scheduled to meet with the tiered standards work group in a few weeks on November 10th. So we want to, again, do a little bit of a deeper dive with some more data with that group. Obviously, we need to factor in things like COVID and things that have happened over the last year. You know, this isn't all happening in a vacuum. And we want to continue the conversations with people and providers to talk about what might be some next steps. So again, looking at something like facility-based career exploration, when there's only a few people all told across the state accessing it, that could be a potential place for a tiered standards discussion. Is that a service that in the future we need or want, and other services that might be more important to focus on, like perhaps the career exploration small group where there are more people accessing it. So we'll keep stakeholders updated on those conversations as they occur, but DDA is really committed to making kind of data-driven decisions that are based on what people need and want. Okay, so I hope everybody's hanging in there. I know this is a lot of information, and we're in the home stretch here. So hang in there with me. If you need to stand up or stretch, please do so. But now I'm going to switch and talk briefly about the community settings rule. And if by chance you've never heard of the community settings rule and you want to know what it is and what it means, then I would recommend you utilize the link that I provided here, and it'll give you some background, because I'm not going to get into what it is. But instead, I really just wanted to acknowledge here that CMS has granted an additional year to states to fully demonstrate full compliance. And the new date is March 17th, 2023. This is an extension of the previous deadline of 2022. So many of you may have already heard that, but I just wanted to make it known across the board here. And that extension was prompted by the impact of COVID-19 on state systems. So, states had to focus on other things. Providers have they're focusing heavily on health and safety. We have relaxed flexibilities around even settings and things like that to get through this pandemic. So that provides another opportunity to do that. So specifically related to non-residential settings, again, this is just a reminder that new providers and new sites that are approved after 2018, including all services provided under the community supports waiver, must currently be in and maintain ongoing compliance. Again, that's not new, that's always been the case. And providers and sites that existed before 2018 under the community pathways waiver have until March of 2023 to come into full compliance. And as a reminder, again, this is a little historical stroll back in time here. Back in 2018, DDA did site validation visits to those non-residential settings, and at the time provided letters to communicate to providers what their site status was at that time, as well as recommendations of what providers could do to come into compliance. And I'm fully aware that some providers are still working on that and still working with the regional offices, whether it's to change or update policies or procedures or practices, and we'll continue to have those conversations. And I realize that this webinar is all about meaningful day services, but I do have a captive audience right now. So while I'm here and while I'm talking about the community settings rule, I also want to say a quick word about residential settings, because I assume that there are also people listening that are residential providers. So same as what I said for non-residential, new residential providers and new residential sites approved after 2018 must currently be in and maintain ongoing compliance. Providers and sites existing before 2018, again, have until March of 2023 to come into full compliance. Back in late 2019-ish, DDA also did site validation visits to a sample of residential settings. So unlike the non-residential, DDA didn't visit every residential site. And those letters have not yet been sent to providers. So the status is that ultimately DDA is committed to getting all of those letters sent by July of next year. And along with that, to be able to provide more detailed guidance and training at the same time, because what we didn't want to do was send the letters out in a very piecemeal fashion. We wanted providers to be able to get the information all at one time related to various sites, along with any additional guidance that DDA has. And as stated, things related to COVID took priority on that. So again, stay tuned. DDA will be developing that guidance in early 2021. So give me a second to just check for questions before I move on. Okay. And I want to provide a few quick reminders about DDA's employment outcome data. I get a lot of emails from people about this. So this is kind of here are the top 5 things that I get emailed a lot. And I want to point out the resources that are available if you have questions about any of these things. Okay, so first, the first question that I get asked a lot is who has to submit data? So it's a tracking requirement for all meaningful day service providers. And yes, that means even if no one you support has a job, and even if you don't provide employment services, okay? So if you just provide day habilitation or community development services and nobody you support has a job, you're still required to submit data. Because again, as a reminder, it's not service-related data, it's simply data that tracks outcomes that people have related to employment and community membership. So we want to know that across services and don't want it to just get it for just employment service providers. We want providers to enter information on the people they support in their meaningful day services using a 2-week period of your choosing, anytime between October 1st and October 31st. And the deadline for entering the data is November 30th. So you have an additional month after the tracking period is over to get your data in. The system is open now and you can begin submitting data anytime you want. So if you have already tracked your data for the beginning part of October, then you could submit it. And there's a link there. You can use your email address as a password if you don't have your username and password. And if you lost your password, you can use the request new password function if needed. So I want to make note of a few things because we did add a few COVID-related data points, okay? And the most important one is, pardon me, skipped ahead. If a person did not participate in integrated competitive employment or individual contracted job or group integrated job during the month of October, we want to know, did the person not participate in those activities because it's related to COVID? And because this is really going to be one of the only ways that we can get good data about that. So it could be that a person that you're tracking maybe never had a job to begin with, and that's fine. We just want to know on our end, is the reason they're not working now related to COVID, okay? And please note that you have to answer this question in order to be able to complete that person's record if they didn't participate in those activities. Again, this will be what we think very critical information to help DDA better track the impact of COVID on people that we support and specifically their employment. Because again, we've said multiple times, we really want to make data-driven decisions, and it's going to give us kind of a moment in time of where are people right now, who's working, who isn't, and if they're not working, was it because of COVID? Was the person terminated? Did they get laid off? Or perhaps they voluntarily chose not to go back to their jobs. And those are all important pieces of information. And the other piece of information that's related to COVID that we want to know is for all of the activities, you'll be asked whether the person received remote supports, in-person supports, or both remote and in-person supports. Because again, this will give us some pretty critical information about how people are being supported right now. We know that many people are receiving remote supports, but we don't know, for instance, how many people that are working or getting remote supports or in person or both. It's just going to give us some good data, kind of a baseline, so we can figure out what other types of supports might be needed in the future. And we've received a few questions this week that relate to the use of remote supports and how it might factor in how to categorize particular activities. So again, for those of you that have been submitting this data for years, you know that you're asked to document whether the person took part in community-based non-work activities or facility-based non-work. So the question is, what does it mean if a person received supports remotely? How do you figure it out? So again, this is not service data. It doesn't matter which meaningful day service a person's receiving. We're simply interested in the outcomes. So essentially, the COVID-related flexibilities allow the person to receive any of those services remotely. So I'm going to ask you to use these guidelines when you're trying to figure out, was this activity that the person took part in community-based non-work or facility-based non-work? So community-based non-work is defined as unpaid time spent in integrated community settings in a group of 4 people with disabilities or less, while having access to others without disabilities who are non-paid staff or family members. And that's the same definition we've used in the past, but with the addition of the next sentence. This could include activities that occur remotely, but they actively connect the individual to integrated community settings, activities, and people without disabilities. In other words, the mode of connection may be remote, but the person is still accessing the community in a meaningful way. And facility-based non-work would be individual spends time in unpaid activities in a program setting with people with disabilities. And this could include activities that occur remotely, but connections are with paid staff or only other people with disabilities within the program. So again, I want to recognize that I know that many people are receiving meaningful day services, maybe from their homes, from different settings, and I don't want you to get too bogged down in those things. Just when you're thinking about, was this activity, was it a non-work activity, and was it connecting to the person to their community, or was it more connecting them to their paid staff and other participants in that program? That's going to help guide you on whether it's community-based non-work or facility-based non-work. And again, I provided resources here. The first is a link to the actual data site, so you can look at that if you need to. The second one is an information and a how-to document. It's a really good document, and I'm going to be honest, 99% of the questions that people email me with, the answers can be found in that document. So I'm going to say it's a really good document to read. It includes a list of the required data fields, how to get into the system, what happens if you don't have a username and password. There's also a frequently asked questions document. And please note that DDA does not run the system. John Shepard at the Institute for Community Inclusion is the technical contact for this project, and he can be emailed at the email address on the screen, mdda@statedata.info. And also, he gets a high volume of these emails, so it's helpful to have them go in through the system like that rather than them come to me or somebody else at DDA who just forwards them on to John. Again, his email information and all of that is available in the resources I just mentioned. Let me stop for questions real quick. Oh, somebody says this was helpful. Thank you, Marcia. I love to get positive feedback that this is helpful. I appreciate that very much. All right, so congratulations. If you are still on this call and you're still listening to the sound of my voice, you get a gold star. It's a Friday afternoon. This is not the most riveting information, so thank you, and let's wrap things up here. Okay. So again, today's webinar was meant to highlight some things that probably weren't completely new to you. I wanted to just, again, highlight things that may have gotten lost in the shuffle over the last year for obvious reasons, because COVID has taken priority, and obviously it will continue to do so. But I wanted to also make you aware of other resources that exist. So DDA is going to continue to work with the Employment First state leadership team around a lot of the things I discussed today. DDA is also creating an employment services operational manual or guide that will give even more detailed operational guidance to go along with the Meaningful Day policies and guidance that have already been published, and again are on the policy stat site that I told you guys to please read. DDA will, let's see, again, continue to further discuss with stakeholders the concept of value-based payments and how they might fit into future funding models for our employment services. So again, if you're interested in potentially being part of that work group, you're going to email Patricia Sestoki and let her know that. What you can do at this time, again, is read the resources that I've provided. You could go back and watch old webinars that maybe provided more in-depth information about the employment services. You can get on our mailing list if you're not already. You can read our Employment First newsletters that go out every month, where we try to highlight any big things that you might need to know about. So before I end today, I do want to share some bittersweet news with everybody that's listening, that my last day at DDA will be on November 30th of this year. I've been in my position now at DDA for about 3.5 years, and it's really been a huge privilege to work with all of you and to do the work that I've done at DDA, especially as it relates to really highlighting the values of Employment First and DDA's transformation. I sincerely have valued the relationships that have been created in that time. And I know there are so many incredibly dedicated and passionate people and partners in our state that support the work that we do at DDA. And I would like to say a personal thank you to all of you. In the next month, I will be working directly with Patricia Sestoki, our Director of Programs, with creating a continuity plan around this work, so that there's a smooth transition when I leave. So moving forward, if you have any Meaningful Day or employment-related questions after November, please send them directly to Patricia. And finally, I'm going to take one last look at the question box, but if you do have additional questions, if you have questions, things that didn't get addressed today, you can certainly send them along to us, and we will always use them to kind of fold into additional guidance or feedback or additional webinars that DDA will hold in the future. So hold your horses 1 second while I check the questions, make sure. Oh, lots of congratulations. I don't want to cry on this webinar, so I'll try to skim over those. Oh, here's a good question. Rose asks about, would doors be a part of the Employment Services Operational Guide or other ways to help encourage providers to become integrated with their local doors office? That's a wonderful question. I don't know that specific, that it would specifically go into DDA's operational manual for our employment services. However, I do want you to note that on the DDA website, on our Employment First page, if you scroll all the way down to the right-hand bottom, you will see a memorandum of understanding with DOORS and DDA that has information about our flow of services between the two fundings. And also, if you go to the our link to our employment webinars, and hopefully you guys all know that we also have a YouTube channel where all of our webinars are uploaded. You will be able to find two webinars that DOORS and DDA created together that talk through what might be helpful to you, Rose. about how to access both services. And DOORS and DDA will continue to work on additional guidance related to that. So more to come on that as well. And that's a great question, because you're right, that's very important. Somebody asked, how do we access former webinars? So again, if you go to the DDA website and you go to the employment page, on the right-hand side under, I don't have the web page open in front of me, but there is a link that says archived employment webinars, and they're all on that page. Okay. I'm glad this was useful. Oh, I'll miss you too, Dominic. Oh, congratulations. Thank you. Thank you. I'm glad it was informative. Okay. I think I got it. Thank you all for your well wishes. I hope everybody has a wonderful weekend, and we'll talk to you soon.